Let's talk about some bias in healthcare. It's so hard to avoid this at times, but let's have a conversation about it. Acknowledging that there's some subconscious bias that might be happening in us as healthcare providers. We may not, as an individual, fully understand or believe some things that that patient is bringing forward that they might be doing as part of their healthcare team. That's okay. Understanding and acknowledging that is the first step. And just making sure that that patient has a full understanding of what you're doing in your office is so important, and ensuring that they understand who the members of their healthcare team are is also something you can do just to simply acknowledge. I understand you have a healthcare team outside of the office. Share more with me about that. Ask about who they are and encourage an open dialogue about who those members of their team are, even if you have some subconscious bias about it. I think just understanding that this could happen is step number one and so important. And sometimes it's hard to avoid, but I think just being aware before you speak is just a powerful, powerful piece of advice. Let's talk about second opinions and referring care outside of your office. That can be hard sometimes, but understanding that patients deserve that and that they maybe even have that as part of their team is step number one. Establish some clear guidelines inside of your clinic of what are some resources that you could add, see this as an opportunity. What are some areas that you could add to your office that perhaps patients are seeking outside? Could you bring in a coach? Could you bring in a nurse educator? Could you bring in mental health services instead of referring them out? But we have to understand that sometimes patients need access to those services fast and right away. Please don't hesitate to refer. Encourage second opinions. They're very powerful, and they allow patients to get some outside opinions and then come back and make a better decision on your steps that you talked about moving forward. Build a network of other trusted healthcare providers. Who are those other providers and other areas or specialties that you don't have or that you are not able to perform that you trust? Build that into your patient handouts, your websites, your aftercare summaries, and give them, those individuals, information so that moving forward they have that in their hands and they can make a decision after your appointment with them. Provide support group options for them. Who are those trusted individuals and partners that can provide much needed resources for them that, again, you may not be able to provide for them? There's so many wonderful, amazing providers out there doing great work in this space. Encourage questions. Allow time, space for that patient and couple to ask absolutely any question. I always tell my patients, there's nothing silly, goofy that you're gonna ask me here. Know that you are in a safe space right now. And in this safe space, I am here to allow you to ask me anything and share anything with me in this time. Let's talk about how you can leverage technology and social media. I know. It's not fun, it's uncomfortable. Perhaps you think it's not something you've even dipped your toes in, but it's here to stay and it's growing. And it's exciting because that's where the patients are at. They are on the social media platforms, the support groups, the Facebooks and website groups. They are there. Leverage it. Encourage patients to even use apps. There's so many amazing apps and outside tools that can be utilized to help them better understand what they're going through or help clarify what you might have just talked about during your visit today. It can help provide additional diagnostic clarity as well. There's so many things that can be brought into the home with technology nowadays. It's amazing tools that you can leverage to help you as well. Telemedicine. Don't underestimate the power of telemedicine and having providers in your office utilize that as a tool. It's here to stay, I hope. It's an amazing resource that is utilized so often by patients. I've even noticed when they are using telemedicine in their beds, in their office space, in their cars, they are much more likely to open up about things and share more with you. We have to understand that there is a lot of factual information out there on the internet nowadays. It used to be Dr. Google. That is gone. There is a lot of healthcare providers putting out a lot of evidence-based information on all the social media outlets nowadays, and patients love that. So please, please, please find a way to incorporate that into your healthcare planning for your patient. I want to end by thanking you for taking time to listening to this today. What you are doing is so important in this space. Never underestimate the power of what you are doing for patients in this healthcare setting. And thank you for taking the initiative to learn more about how you can better listen and improve your patient outcomes by empathy, communication, and understanding ways and things to incorporate into your practice that will provide better outcomes for your patients.